Hi, I'm Dr. Jessie Cheung. I'm the Associate Director of Cosmetic Dermatology at NYU Medical Center. Today we're going to talk about treatment options for the aging face. So usually when I see a patient, I ask the patient what bothers them, but today we're going to address the whole face. So we're going to start from the top. So our patient here has lines that you can see at rest. They're kind of etched into her forehead. And these we would, want to treat with Botox to relax the muscles to prevent them from crunching the lines in even deeper. But eventually the patient might want to have what's called laser resurfacing to kind of erase those lines, or sometimes even a deep chemical peel to again, erase those lines and create more collagen to come in and to soften this whole area. We're going to talk a little bit about the area around the eyes now. These are the crow's feet. And you can see our patient here, she actually has these lines at rest. Again, they've been etched in from just continual muscle movement, the crunching of those lines. Can you give us a big smile? So you can see how, again, the lines come out even more when she's smiling. So what I would do here is you want to do some Botox to prevent the muscles from, creating those lines and getting them even deeper. But she would also want to erase those lines with either laser or some deep chemical peeling. So chemical peels have been around for many years. There's superficial, deep, and superficial, medium, and deep chemical peels, and the recovery time, definitely varies between the superficial, medium, and deep. Deep chemical peels, they can be kind of risky. There's serious side effects like scarring, pigment changes, a permanent whitening of the skin sometimes. So the people have kind of gone from chemical peels to lasers because lasers, you kind of know what you're going to get. You can kind of control the depth of what you're doing a little bit better. With more technology, you kind of get a little bit more, precision, we can say. So with lasers, again, you can have a huge realm of downtime. We have lasers that there's no downtime, but you need multiple treatments to get the results you want. We have some other lasers where you have 4 or 5 days of downtime. You look wonderful. The older lasers we used to use about 2 weeks of downtime. Prolonged redness for months afterwards. But most people don't use those lasers anymore because of the downtime. We were talking about just doing Botox in this area just to kind of keep those muscles relaxed so she can't crunch them deeper. But again, just erasing those lines even. And the same even for the lines under the eyes, the kind of crepiness of the skin. When you look at our patient, she definitely has these tear troughs, and this is one of those controversial areas for dermal fillers. Complications reported in this area. But I think if you know how to use those fillers properly, what we do nowadays is we actually inject very deep right over the bone under this tear trough, and what that happens is you kind of plump the skin back out. You kind of get rid of that big depression in that area, and it helps smooth the skin out too at the same time. So it's one of my favorite areas to inject. When you look at the mid-face, the movement nowadays is going, instead of injecting this area, we actually injected this area right here because what that does is it redrapes the skin. It actually kind of tenses this skin back up by giving volume back to the cheeks, and this actually kind of helps to erase this line. If you can imagine, injecting here would tent the skin back up and just help erase that line. So you can see here she has the lid, this cheek junction has been broken right here, so I'd actually fill this area for her. I wouldn't really put too much here because that would, give her more flattening of the face in that area. So, and then moving down to the jaw area, she has these marionette lines right here. This is a great area for fillers. The fillers we just inject in this area, kind of smooths this area out. Some people even inject right here. And you can Botox this muscle that runs down. This muscle kind of pulls the lips down. And what we do is when you put filler here and put Botox here, you turn the frown upside down. So you kind of give a little bit of support to the lateral lip. So, Botox and fillers. So what's great is that you can combine Botox and fillers. One does not exclude the other. They work great together. And, I can do lots of other things too, but we'll save that for a later discussion maybe.